to for at least another week. City government offices and facilities are also in stage 1 of reopening operations as well. And you can learn more on how to receive city services at richmondgov.com/COVID-19. As of this morning, the City of Richmond's Health District is reporting 1,527 cases of COVID-19 in the City of Richmond. And there have been 13 total positive cases in our city's workforce. 25 Richmond residents have lost their lives to this disease, the novel coronavirus. And at this moment, I'd like to observe a moment of silence for those we have lost. Thank you. The city is still executing its strategy of boxing in our virus, the coronavirus, that relies on 3 steps. That's testing, tracing, and isolating. We continue to fight to make those 3 as accessible as possible to every Richmond in our community, every Richmonder in our community. First, I want to say thank you to those who have been tested. And a lot of Richmonders are coming out to the community events around the city. I know firsthand, having been tested myself, I believe last Saturday I was tested, and that it's not a pleasant experience, but it's necessary to know where you are in terms of your personal health and also on behalf of the city's public health as well. Dr. Danny Avula will speak further about the impact of testing and what is shown in our numbers as well. But also I wanted to remind folks that we still have some community testing sites available over the course of the next week. We have some options coming up on Tuesday, June 9th at Second Baptist Church at Broad Rock, off of Broad Rock Boulevard in Southside. On Thursday, will be June 11th, we'll be at the community supermarket over there in the East End. On Friday, June 12th, we'll be at Hotchkiss Field Community Center up in Northside. Remember, all events are from 10 a.m. to 1 p.m., and these events are all free to city residents. And I want to give a big thanks to the Richmond City Health District, the Medical Reserve Corps, for their amazing work over the past 6, 7, 8 weeks when we've been hosting these sort of events and allowing folks to access testing right here in our community. Throughout the past couple of weeks, we've seen an additional partners in our healthcare community come together to offer testing options in addition to the health district's efforts. I want to thank CVS. CVS is now offering drive-up testing at some locations in our city. You can register online or call to find out more about that. As part of my administration's efforts to ensure all of our valued city institutions are working together in response to the crisis, we have partnered also with some members of our safety net operations in the city to support expanded testing at their locations. Those individuals, organizations are the Capital Area Health Network and the Health Brigade. Each have testing events coming up that will be open to the public to register for in the near future. So we ask that you use them as options for testing. For more details about testing, you can also look at rvastrong.org/testing, rvastrong.org/testing. And this is a reminder to those who do test positive at these community testing events. They will benefit from a safety net, the safety net primary care support. If they are under or uninsured, they are there and available to you to help you get through this pandemic. I'm simply telling COVID-19 positive residents, we need you to stay home. We need you to monitor your symptoms. It's not enough for just one person. We have to do this as a community. And for individuals without access to primary care of their own, we provide free consultation with a physician to help them process the test result, understand it, what it means, and give them the help that's necessary to support the needs that they have because of the virus. Similarly, if an epidemiologist recommends an individual for voluntary supported isolation, that individual will get one-on-one guidance from a health district social worker or a community health care worker to get a hotel room and keep their families safe for the entire isolation period of the virus. Ladies and gentlemen, this is a total team effort. As I said, many weeks, this is the biggest team project, biggest team experience that we've ever had in our lives. And it's going to take each and every one of us following these guidelines, wearing our mask in public, social distancing where we can, continually washing our hands, getting tested, the work of our contact tracers. And if you do test positive and you need help isolating, we can help you with that as well. Now, despite the fact that we are in the middle of a pandemic, there were frequent mass gatherings this past weekend and throughout the week. And let me say this. There comes a time when the right thing to do is to march. When the right thing to do is to join your brothers and sisters arm in arm and make demands loudly, visibly, and publicly. The aftermath of George Floyd's murder is one of those times. And we've seen a number of protesters peacefully protesting in our city and expressing their pain of the injustices that black and brown people have been experiencing for generations. We need to remember, though, that there's still a deadly pandemic here in the city of Richmond and around this world, and that also is killing a number of black and brown people at a disproportionate rate. Of the 25 residents in the city of Richmond, of the 25 deaths in the city of Richmond, they were residents who have died from COVID-19. 17 of them were black residents. So still, a disproportionate number of people are suffering the consequences of COVID-19, and I want folks to be aware that we have to continue to be vigilant here. We can't have COVID-19 we don't want COVID-19 catching us slipping, and that's just the bottom line. And I'm always telling everyone around us to continue to adhere to the guidelines. So I urge you, if you have been out protesting, whether you have worn a mask or not, take advantage of these community testing sites. Take advantage of these options. We know that you can have the disease and not even know it. And there's a number of young people who out there who believe they're invincible. At one time, I thought I was invincible as well, but we are not. We are mortals, and we should do everything we can to prolong our health, and that means go out there and get tested, not only to protect yourself, but protect those you've been around as you've been out protesting. So even if you're feeling well, it will give you some confidence to get tested and know if you're negative. Don't risk unknowingly spreading the virus to the people you love, the people you've been marching with over the course of the last week. Go out there and get tested. I think that is a part of our community service right now, and it's ultimately a service to your cause as well. Hey, I was marching this past Tuesday down to the Lee Monument from the Capitol. I ran into a number of people, and I'm going to be getting tested again as well. So, Dr. Avula, you will likely see me at one of your sites again, just to be sure that I'm not unknowingly passing the disease to anyone else. I also want to take a brief moment to share with all of you some of my reflections about the past week. And I will say it's been certainly a painful week in terms of the images we've seen that happened to George Floyd, and a man dying because there was a knee on his neck, which should never happen in this country. And we've seen a number of people leave their homes and come out and protest against such actions and ensuring that those actions don't happen again. As I've said it to my friends and my family, I've been on the verge of tears on many occasions over the past week, because not only do I feel that pain, that could easily be myself my brother, my cousins, my uncle, all members of my family. You know, when I stepped outside of City Hall on Tuesday to apologize to some of those peaceful protesters who were out front, I heard and felt a ton of pain and frustration. These folks have the weight of the world on their shoulders, and they're carrying us right now. They're carrying us right now. They're carrying that message of justice for all right now for everyone. And when I marched with peaceful protesters on Tuesday evening, I met folks from Richmond, other localities in Virginia, folks from out of state, and I had a great opportunity to listen to that pain, listen to where they were coming from. Ladies and gentlemen, our community has a lot of work to do. We've done a lot of work getting to this place, our work in equity alongside some of the partners I have here today, whether it's Jason Cameron at Public Education or Dr. Avula. But what COVID-19 and the unrest we've seen as well shown us, the death of George Floyd, is that we are not as good as we thought we were. We are not as good as we thought we were. It has put a mirror in front of us, and we have to ask ourselves, do we approve of the image that is being reflected back? And I think it's safe to say, if you've seen thousands hit the streets, not only in this city, but in this country, that we are not satisfied with that image. And I want you to know that your local government shares that same feeling, that we are not satisfied. Not only are we sorry about incidents that have occurred in the past, we know that sorry isn't enough, that we have to do better. And we only do that by working together. Some things that we're going to take some steps on moving forward. First, some steps we're going to take for the healing process. We will implement a crisis alert, also known as the Marcus Alert, to ensure that individuals having a mental or behavioral health crisis will receive the help they need in the form of de-escalation by law enforcement and crisis intervention by mental health experts. We're also committed to establishing a citizens review board, independent of the police internal affairs and consisting of a diverse group of stakeholders. To be clear, this is a new body whose mission and composition and legal authority have yet to be determined, and will be engaging the community on the structure and charge of this local CRB as well. You've seen this, Fairfax County has a board like this, I believe, and also the city of Charlottesville. We'll be looking to them for how to, some ideas, but we'll be looking for the community to share with us how we can move forward on what fits the city of Richmond. There are a number of great organizations out there who've been working on this for some time, and I want to thank them for their contributions and hope to have them at the table as well as we create a framework to work under moving forward. Also, at City Hall, we will implement racial equity training for staff and an equity study to dismantle racist systems and policies and build more just ones that provide the opportunity for all city residents to succeed and thrive. If we are not devoted to ensuring that each resident in this city gets the best, then that would be a total disservice to the jobs we have to do here. No matter where you live, no matter where you come from, what color your skin may be, each resident in this city deserves the best, deserves the best. The best in policing, the best in public education, the best in health, the best in housing. And we have to recommit and redouble our efforts to ensure that each and every one in this city gets the best. That's our commitment. Along with Councilman Mike Jones, I will introduce an ordinance to remove all the city-owned Confederate statues on Monument Avenue. That is our commitment. This effort now has the support of I believe, more than 6 council members. And that just makes me very, very proud of not only my city council members that I join in this work, but also just proud of my city as well. That we understand what these monuments mean to our city. These are symbols of hate. These are divisive symbols. symbols that have intimidated black and brown people in this city for far too long. That's what was behind the reason they were erected. And now we get an opportunity to build a city starting and centering it in love and respect for everyone. That's the dignity that's deserved everyone. It's time to remove those symbols. This is a first step. I also want folks to know that I think we tweeted something out earlier today. I spoke to Richmond's Commonwealth's attorney, Colette McKeechin, and I made clear that those individuals who were peacefully protesting and happened to be arrested because of a curfew violation, solely because of a curfew violation, should have their charges dropped. I believe it's the right thing to do. They were peacefully protesting and were solely arrested because of a curfew violation. They should have their charges dropped. And I want, ladies and gentlemen, you to know that our work towards equity and justice in the city only starts here. There is much more we can do, and we want to ensure that as we go about assessing the measures and we look forward to working with all of Richmond and its community on these additional efforts to ensure that we are the inclusive and compassionate city that we pride ourselves in being. As demonstrations continue to be scheduled throughout the weekend, I urge my fellow Richmonders to continue to protest peacefully, and show respect for our city and its residents, the city that you love. Please do not hurt the very community you're working so hard to uplift, and do not allow others to do so as well. Hold them accountable if you see someone doing something to injure this community in a very negative way. There's absolutely no reason to damage public assets like GRT buses, and the last thing our small businesses need right now during a pandemic and also during this economic downturn is more broken windows and damaged property during a pandemic that has already cost them a great amount. That is all I have for right now. I'm going to have Dr. Avula come up and provide an update and on where we are in our public health, and then I'll also have Mr. Jason Cameras, the superintendent of Richmond Public Schools, provide some remarks and an update on RPS. All right? Dr. Avula.
Thank you, Mayor. Good afternoon, everyone. It's challenging to pivot from that to a deep dive on our COVID-19 data. So I would just say that, the mayor very aptly said yesterday that we are facing two pandemics. And as a health department that is committed to assessing and addressing the root causes of all kinds of disease and disparity, we are engaged in the fight against both COVID-19 and racism. And to that end, we really do stand with all of the residents of our region who have been out in peaceful protest. We recognize that we have to respond to both the infectious and the insidious here, and so we want to support people's appropriate response. Now, I'll just say that my wife and our adult daughter have been out almost every night, and at least in most of the pictures they've sent me, they've been wearing masks, and I am so proud that they've taken that stand, and I know that many protesters have. As the health department, we would both support people's continued protest and ask that try to be done as safely as possible, where possible to maintain a 6-foot distance, to wear a mask, and to the degree that you can, if you're protesting with others that you know, try to stay with that group. I have received many questions this week about what will the impact of this protesting be on COVID-19. I suspect we will see an increase of disease. We will continue to monitor and provide surveillance around that, as we are also looking to expand our capacity at testing events. So at the upcoming 3 testing events we've got next week, we really would like anybody who's concerned about either the symptoms they've developed or exposure as a result of these protests to call our hotline, 205-3501, 205-3501. and get scheduled for one of those testing events next week. As the mayor mentioned, there are multiple other options outside of the testing events that the health department is providing. CVS and many other testing events. If you go to the VDH coronavirus website and click on the testing tab, you will see the link to all the places you can get tested. Or again, if you call our hotline, we'll move you in the right direction. Our data, today most of the Commonwealth is moving into phase 2. We here in Richmond are not, and the data points that we had been looking to make those decisions had primarily been our trend in percent positivity, our rates of hospitalization, and our rates of death to COVID-19. Leading up into last week, we continued to see a significantly upward trend of percent positivity, and then over the weekend, things looked very different. So if anybody's following that percent positivity rate, we went from around a 25% positivity 7-day average to 14%. And I want to explain what that is and then talk about how we will address that moving forward. So over the weekend, the State Health Department used a new convention to provide or to assign data to places where they don't have the address. So they don't have the address data on every single lab report that comes to us. So in the absence of the address of the individual who's tested, the test result was assigned to the ordering provider. That means that residents from all over the region could come to a particular provider that was in the city, and that data is now being assigned to Richmond City data. Now, that happened in over 3,500 test results, which means that prior to this weekend, we had about a third of our testing that hadn't been included because it didn't have an address, and now is being assigned to the city of Richmond. My suspicion is that the vast majority of those tests are negative tests, because when we have a positive test, our case investigators and contact tracers actually follow up with that individual, confirm an address, and assign it to the right locality. But when we have a negative test, we don't do that follow-up. And so we are working actively to figure out where the primary providers, where that translation of address has not taken place, and to see if we can fix that so that we have some more meaningful data moving forward. In the absence of that, then we will continue to look at the two other data points that are really important, hospitalization and death data. And in both of those categories, we've seen a flattening of our rates here in the city. I'll say that last week did present a peak in hospitalization around the region. All of 3 of our hospital systems were reporting the highest number of COVID-19 hospitalizations that they had seen to this point. Those numbers across the board in each of our health systems are down this week, so that is a reassuring sign. And so we will continue to monitor the data and provide the best guidance we can about a decision around phase 2 next week. I will say that many of the disparities that we have expressed concern about continue. When you look at our hospitalization rates, you see that over 50% of hospitalized cases in the city are in African Americans, and almost 30% of our hospitalized cases are in our Latinx population. And so that Latinx community continues to be a big area of focus. The mayor mentioned our efforts to help support effective quarantine and isolation. We're continuing to do that. This week we had our first residents take advantage of that isolation in a hotel, and we're going to continue to work both with our partners in Chesterfield and with some additional support from the CDC to really focus on the Hispanic population moving forward. Thank you.
Good afternoon, everybody. First, I just wanted to thank the mayor for his leadership during these increasingly unprecedented times, in particular, his response not just to the COVID-19 pandemic, but to the aftermath of George Floyd's murder. I'm particularly grateful for the policy agenda he's put forth and for the ordinance that he and Councilmember Jones are introducing to remove the Richmond-controlled Confederate statues on Monument Avenue. So on behalf of the school system, I just want to say thank you for your incredible leadership at this time. I also wanted to reiterate that Richmond Public Schools stands shoulder to shoulder with the Black Lives Movement. And we in RPS are experiencing enormous pain and anguish at this time, and I want everyone who is grieving at this moment to know that RPS stands with you. Our commitment is to be more than an inclusive system, to be actually an anti-racist system, which means that we're going to have to do more, address policies and practices, instruction, so many facets of how we do education in Richmond Public Schools so that we can be running in the opposite direction, to paraphrase Beverly Tatum, on that moving walkway of institutionalized racism here in Richmond. I'll have more comments about that next week, but I did want to share that we will be establishing a task force to do a complete review of policies and practices, instruction, and so on and so forth, precisely for that purpose. Turning to our response to COVID-19, I wanted to remind the public that all of the details for our graduation ceremonies, both in person and virtual, we're doing both, are on our website. Both types of ceremonies are happening the last week in June, and so I want to encourage all seniors to make sure they have all of that information and to contact their school counselor for any additional information. In addition, I want all families to know that we are running a virtual summer camp this summer in lieu of traditional summer school. We are partnering with the YMCA of Greater Richmond, with Bell Excel, which is providing some of the academic pieces, and with Next Up to help provide enrichment activities so that our kids will be moving and creating and building as they have been spending a lot of time on Zoom and Google Classroom over the last several months. That RPS summer camp at home will run from June 29th through July 31st. It is free to all RPS students. You can register by going to our website, rvaschools.net. Each week we'll have a theme. Week 1, RPS Strong, developing healthy minds and healthy bodies. Week 2, RPS Calm, learning mindfulness and meditation. Week 3, RPS Active, getting up and moving. Week 4, RPS Loud, making music and dancing. And Week 5, RPS Creative, unleashing creativity. Next, I want to reiterate that we will be continuing our meal distribution in partnership with the city's Department of Parks and Recreation throughout the summer. So that work will continue. And then last, on reopening, as with everyone, we are awaiting guidance from the governor's office and the Virginia Department of Education about what that will look like. I will tell everyone we are actively planning for both a virtual opening and a hybrid opening, where we will have some socially distanced in-person instruction and some virtual instruction. We're preparing for both of those options and various permutations of those so that we are ready to reopen when the time comes. I will note, we want to do this with our families and our employees, which is why next week we will have a survey going out to gather information about both our families' comfort level with returning under social distancing guidelines and our teachers and other staff, their comfort level with doing the same. Thank you.
All right, we'll take a few questions. Okay.
Talk a little bit about the hotel program. What do people need to do in order to get assistance if they test positive but can't isolate from family?
Dr. Avula.
So right now, every time, the question was some more information about the hotel program. How can families actually access that? So each time somebody tests positive for COVID-19, they are followed up with by a member of the health department staff. The health department the contact tracer or case investigator will talk through, what that individual situation is, how long have they been symptomatic, what's their home situation, are they effectively able to isolate at home and not expose other individuals. Now, based on all of those different factors, the number of people in the house, the length of time that they've had their symptoms, if it's deemed that they are not able to effectively isolate at home, then we'll offer the opportunity to finish out their isolation period in a hotel. The goal is really to give them a place to isolate so that they're not continuing to spread disease to others. So that has been particularly important in households where there are just a large number of people, or particularly in multi-generational households where you've got elderly residents living in the household who may be at higher risk. So our contact investigators will walk through the criteria and help facilitate that handoff to the continuum of care who will end up placing them in a hotel.
I do.
Okay.
As we head into the weekend and just the heat in general, your message to protesters who are going out there again, what do you tell them as, again, we just don't know what to expect or the crowds that will be coming in?
Yeah, we obviously have had a number of people from different localities come to Richmond to express their pain and have their voices heard. I've always stated that as the capital city, if you want your voice heard, you come here if you want to get your voice heard right here in the capital city. First, our request is to be peaceful. There are a lot of Richmond residents who will come out there and also exercise their First Amendment rights. We want them to be peaceful. The overwhelming number of people who've shown up each and every evening have been peaceful. And we expect it to continue that way. Obviously, hydrate, because it's going to be hot. Wear a mask if you can. I saw a number of people not wearing a mask. We request that you do so. Even, if you're going to be that close to one another, Dr. Avula, would you say wear a mask? Absolutely. Wear a mask. Any other questions?
So you said you plan on getting tested after walking with the protesters, and that you were tested, I guess, was it last week?
Yeah.
Did you receive the results before going out with the protesters?
Believe it or not, I've received a number of phone calls over the last week. I have not been able to go back through and see which number is from the health district, but maybe you can help me out with that. But one of my aides was tested and he got his results back, so that means I got mine as well. I just haven't been able to dig through the voicemails and see which one is, whether or not mine is. I believe I'm positive, but that's why I wore this mask, because you never, I'm negative. It's been a long week. Don't step away like that, Kitty. It's been a long week. I believe I am negative, but I'm going to check my results just in case, and I'm going to continue to wear my mask, okay?
Thanks a lot, guys. We appreciate it.
Thank you.
Can I actually make one more comment?
Dr. Avula wants to add one thing.
I think with the increased protesting activity, the desire for people to both monitor their own symptoms carefully for 14 days, because that's the incubation period of the disease, but also, if you are concerned, to get tested. And it doesn't necessarily make sense to get tested the next day or the day after, because remember, the disease needs some time to incubate. So what we're recommending is that 5 to 7 days after your last exposure, that you pursue testing at that point.
All right. Ladies and gentlemen, have a safe weekend. Continue to be strong and healthy. Thank you.